Extract 1, questions 1 to 12. You hear a gastroenterologist talking to a patient called Andrew Taylor. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Taylor. Now, you've been referred to me because it's possible that you're suffering from irritable bowel syndrome or a related condition?
Yes, that's right.
Okay, could you start by giving me some background?
This has been going on for many years. After meals, I've always tended to get heartburn, but I found that pretty easy to deal with by taking antacids from the pharmacy. But a year ago, things suddenly got worse, and there were other problems I started to notice. The symptoms vary a lot, and they can be quite hard to describe exactly, but the main problem is bloating.
I see.
I need to tell you about some other things related to my stomach.
Mm-hmm.
Although this isn't something that happens every day, I've been suffering from constipation in the last month. In the past, I've had the opposite problem and would rush to the toilet several times a day.
Mm.
I just never know how I'm going to feel from one day to the next. It's the way the symptoms are so unpredictable that I hate.
Mm.
It's hard to plan my life.
Were there any other symptoms unrelated to your stomach and bowel?
Well, I have a skin condition that can flare up, and I know this could be related to irritable bowel syndrome.
Mm-hmm.
And the odd thing is that I often have migraines more or less at the same time as the stomach discomfort, and these can go on for days. It's strange, and I didn't at first think it was anything to do with my stomach problems.
Have you noticed anything that can intensify the symptoms in any way?
Well, I have a very demanding job as an accountant. I don't know whether this has a bearing on anything, but there's a chance I might lose my job in a reorganization of my department,
Mm.
so that's obviously something that's making me anxious. I don't know what's going to happen.
What's the worst effect the condition has on you?
The problem isn't just that it's nearly always on my mind unless there's some pretty big distraction, but also that it's so draining. What I mean is, I often feel that I've got no energy at all. I just want to sit around and do nothing when I get home from work, to be honest. I go to bed tired, but I'm frustrated because I have insomnia much more than I ever did before. I wouldn't say I've been suffering from depression, but a condition like this can make you feel rather down.
Mm. Right. And I understand that you've investigated the possibility that your diet's responsible for your condition. Can you tell me about this?
I was told by a nutritionist I saw that people with irritable bowel syndrome often don't eat enough fiber. In my case, I don't feel that's an issue. I've followed the nutritionist's advice about taking more fluids during the day, especially water, and accept that in the past maybe I didn't do that enough. It's hard to say whether that's made a difference, but possibly it's caused a slight improvement.
Uh-huh.
I'd read that dairy products can make things worse, so I tried cutting them out, but I wasn't convinced it made any difference. I've cut back on caffeine, though not much, actually. I also paid for extensive food allergy tests, but they didn't show anything major, so that's not an area my doctor thought was worth investigating further.
What medications have you tried?
Well, I took something called an antispasmodic,
Yep.
which my GP says helps to relax the muscular contractions which move food through the gut, but to be honest, I don't think it made much difference in my case.
Have you taken anything else?
Well, I've been given antidepressants, and I'm giving them a go. I
Right.
wasn't sure I completely understood the reasons.
Okay, well, a drug like that targets the signals being sent to and from the nerves in the digestive system. It has a calming effect on the muscles there.
hmm
Do you find that this drug was effective?
Yes, I'd say it was on the whole. Um,
You hear a GP talking to a patient called Mrs. Wright. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Afternoon, Mrs. Wright. I'm Dr. Kildare. Now, unfortunately, your usual GP is away today, so I'm going to help you if that's okay.
That's fine. Thank you for seeing me.
Okay, so I've got some notes, but it'd be helpful if you could tell me, in your own words, about the problems you've been having.
Well, Dr. Grimmett asked me to come back and check in about my foot. I've had gout, you see.
Okay, so just remind me, what happened with your gout?
Well, the first time was late last year, about 2 or 3 months ago. Dr. Grimmett had to treat me at home. It was pretty bad. I could hardly walk. We used steroids in the end to get a hold of it. I had the prednisone tablets, 30 milligrams for 5 days.
Right.
All the blood tests showed that I had the tendency to gout from crystals, so Dr. Grimmett gave me the allopurinol, trying to calm that down longer term. The doctor said to contact the clinic if it got worse, or come back around now just to check in.
Right. So we haven't seen you. Is that a good sign?
Well, I had, it was a good job I had the repeat prescription for steroids, because just after Christmas I had a bit of a flare-up again. I suppose I was eating a bit too much rich food and probably had more to drink than normal, but I have been watching it a bit. The doctor recommended I drink more water. He said 8 glasses, a couple of litres. And I've been trying, but it's a lot, you know, and I'm busy, so I don't think I drink more than 6 glasses through the day. But it's definitely more than before.
Right. Well, that's really good to hear. Water can definitely help, so it's great that you're keeping that up. Sorry, do you mind just describing where the swelling was when you had it?
Yeah, sure. Well, both times it started down the side, kind of at the base of the second toe on my left foot, there. And then the whole foot swelled up across my smaller toes to the outside of my foot.
Ah, I see.
And both times I started getting a lot of pain, and it was all kind of spreading down from that area, and it went across the toes and started swelling up quite badly, really hot and inflamed. But it never goes to the big toe. So the second time, it never swelled up quite as bad as it did before, but I think I caught it in time when I went and got the steroid tablets from the chemist.
Ah, good. So how long did it take to settle down once you started the tablets?
It was a lot better than last time. I went straight back down within a week, so it was a lot better.
Right, and when it settled down completely, is it back to normal?
No, it's never been back to normal. I still have pain on that second toe where it always was right from the start, and I've still got it now.
Right, and how are you getting on with the allopurinol?
Yes, it seems to be better. I don't have any problems with it. I'm taking them okay, but like I say, that second toe is still giving me a little bit of a problem.
I see.
At the time, the doctor actually wondered if it might be a stress fracture, but I had a foot x-ray and that was clear. But I just think it's a bit unusual that it's still sore, and at the same time, everything points to gout, and the blood test confirmed that was the most likely thing. But that toe, it isn't the usual joint, as you know, for gout. It's usually the big joint, isn't it?
Yes, that's right. The big toe is typical.
But when I had the flare-up, the steroids really helped quite quickly. I stopped taking painkillers after 2 days at most. I feel like it's less severe and we've got a hold of it better. So I guess that means the allopurinol is helping, right?
Yes, I think so. So I'm still quite keen to carry on with that tack.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
You hear a physician talking to a group of trainee doctors. Now, read the question.
Honeybees have barbed stingers that are left behind in the person's skin after the initial sting. If the stinger is removed by pinching the stinger, more venom is actually injected, so it's better to remove the stinger by gently lifting it using a pair of tweezers to remove it from the skin. Generally, honeybees aren't aggressive and only sting in self-defense. However, in some cases, a person will disrupt a hive or swarm of bees and get stung multiple times. If a person gets stung more than a dozen times, the accumulation of venom may induce a toxic reaction and make them feel quite sick. And multiple stings can be a medical emergency, especially in children, older adults, and people who have heart or breathing problems. So make sure to check with the patient and be aware of the signs of multiple stings.
Listening Part B. You hear 2 dentists discussing a patient. Now read the question.
I've just seen Mr. Butler, one of your regular patients. He's been in some pain recently.
Right. I've been fully booked for the past few weeks, and he told reception he couldn't wait any longer. He's had chronic periodontitis for some time now, but I gather it's worse.
Yes, I provided thorough curative treatment in all quadrants today, but his gums were in such poor condition and there was severe mobility in his lower right first and second molars, so I had to extract them. I've scheduled him for implant surgery, but I'm worried about his broader health issues and whether or not he's been taking biphosphonates. I couldn't find any information in his records about it.
There isn't any, no. You may have to contact his GP.
Okay, I certainly want to reduce the risk of any osteonecrosis after surgery. Listening Part B. You hear an optometrist giving a presentation to a group of teachers. Now, read the question.
About 1 in 12 boys is colourblind, and 1 in every 400 girls. So in each school class there are likely to be at least 1 or 2 students who are colourblind. Because they are colourblind from birth, most people don't know that they're colourblind. They don't know that other people see things differently. being colourblind can cause difficulties when it's important to be able to see lots of colours, such as on a computer screen or in art classes. Boys should have their colour vision tested when other people in the family are known to have colour vision problems. If people on both sides of the family are known to have colour vision problems, then girls should also be tested. Colour vision testing can be done by optometrists using specially designed charts. Some school health services and some doctors will also be able to test colour vision.
Listening Part B. You hear a radiographer talking to a patient about their CTC examination. Now read the question.
Okay, so your appointment's scheduled for 8:30 next Tuesday morning.
That's great. Thanks for organising that.
No problem. Now, the main purpose of the CTC examination is to look for abnormalities or polyps in the large bowel with the use of a CT scanner. So that means 3 days before the test, you'll need to start eating a low-fibre diet, and then 24 hours before the test, you'll be drinking clear fluids and you'll need to abstain from alcohol. Then on the evening before the test, you'll need to take laxatives as prescribed by your doctor with several glasses of water. You also can't have any breakfast on the morning of the test, and we'll need you to be self-administering some suppositories at that time. But all of this information is set out in the letter. If you've got any questions or concerns about it, make sure you contact either myself or your doctor.
Okay, thanks.
Listening Part B. You hear a physiotherapist speaking to a support group for Parkinson's disease. Now read the question.
The physiotherapist's aim is to maximise the patient's functional ability and quality of life. Physiotherapy can help alleviate symptoms like tremors, rigidity, slowness of movement, and impaired balance, which can cause abnormal gait and posture. It can also help with cramps and pain in the muscles, and even help patients who experience reduced fine motor coordination. Physiotherapists use physical treatments such as exercise to prevent or reduce stiffness in the joints and to restore muscle strength and mobility. As well as this, physiotherapists can supervise the patient's exercises to help maintain their posture and balance and advise the patient about ways of preventing or reducing the risk of falls. Physiotherapists use other treatments such as heat and cold or electrical equipment like ultrasound to help relieve pain patients may have. They can also advise or train parents and guardians of patients suffering from Parkinson's disease in safe and appropriate ways of helping them with mobility problems.
Listening Part B. You hear an oncologist talking with a patient about their test results. Now read the question.
Well, I'm happy to report that the colonoscopy has found no evidence of cancer.
Are you sure, Doctor?
I know you're worried because your father had bowel cancer, but your test came back negative, so that's a good result for you. And let me reassure you, we can see cancer if it's present in the colon in more than 90% of cases. So we miss very few early stage cases.
That's a relief, Doctor. It really is. But then we still don't know why I'm experiencing these abdominal pains.
Actually, we do. We discovered that you have something called diverticular disease. Have you ever heard of this condition?
No, I haven't, but it sounds pretty serious.
Well, if we follow the proper management, it doesn't have to be so serious. Let me tell you a little bit more about it.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1, questions 31 to 36. You hear the discussion between a senior doctor and junior doctors on differential blood test. You have 90 seconds to read questions 31 to 36. Hello, doctor. What is a differential blood test?
Well, a differential blood test enables the physician to determine how many white blood cells are in the body. There are 5 types of white blood cells, and the test also shows how many of each type of white blood cells are present. The results provide details about the condition of a patient's immune system and its response to diseases.
Who requires a differential blood test, doctor?
A differential blood test helps diagnose a range of acute or chronic conditions. And often this is ordered when trying to confirm a diagnosis, such as for any signs of acute illness, such as the flu or urinary tract infection. Or else they may be looking for a chronic condition, such as an autoimmune disorder, or one that affects the bone marrow. The bone marrow is responsible for producing white blood cells, so changes in white blood cell counts can indicate the functioning of bone marrow. A differential blood test may be ordered if a patient has symptoms, such as body aches, chills, fever, a headache, pain, or particularly in the bones. Although a differential blood test can indicate problems with the white blood cells, it will not be the only test that is used to make a complete diagnosis. The 5 types of white blood cells are: neutrophils are the most common type of white blood cells, which are responsible for destroying bacteria in injured or infected tissue. Monocytes also destroy bacteria, causing chronic infections and a role in repairing damaged tissues. Eosinophils are responsible for treating infections caused by parasites, and they also control the immune system response to allergic reactions. Basophils are the least common type of white blood cell, and their function is yet to be defined. However, they may play a role in allergic reactions. There are 3 types of lymphocytes. B lymphocytes generate antibodies to attack specific viruses, bacteria, and other foreign invaders. T lymphocytes help to identify cells that require an immune response. The third type, called a natural killer cells, destroy cancer cells and viruses. Therefore, each type of white blood cell plays an essential role in the immune system. When a differential blood test result is received, it should also contain a reference range of normal values from the laboratory to evaluate if the white blood cell levels are low, normal, or high. Overall, an increased level of white blood cell count than normal level may indicate the presence of an infection. Typically, normal values for neutrophils are between 2,500 and 6,000 cells. A person with a very low neutrophil count will have fewer than 1,000 cells, a condition called neutropenia. While the results of a differential blood test will give details about all 5 types of white blood cells, a doctor will usually focus on just 1 or 2 types. Depending on the type of cell, high or low levels can indicate different issues, such as a high level of basophil count can indicate certain types of leukemia, including chronic myeloid leukemia. It can also be an indication of severe allergic reactions. Patients with inflammatory disorders, such as rheumatoid arthritis or ulcerative colitis, may also have high basophil counts. Typically, a low basophil count does not indicate a medical condition. However, allergic reactions, stress, steroid use, and hyperthyroidism can result in a basophil count. A high eosinophil count is caused due to an allergic reaction such as asthma, eczema, or a reaction to a medication. Inflammatory disorders such as celiac disease or inflammatory bowel disease can also cause high eosinophil count. Usually, eosinophils are present in such a low quantity that low readings do not tend to indicate any health condition. However, stress or steroid use can also cause a low eosinophil count. A high lymphocyte count can indicate an acute viral infection, such as chickenpox, herpes, or hepatitis. Or else, a lymphocyte count may be high due to a bacterial infection, such as tuberculosis or pertussis, or a condition such as lymphocytic leukemia or lymphoma. A low lymphocyte level can indicate an autoimmune disorder such as lupus or rheumatoid arthritis. The presence of tuberculosis, HIV, hepatitis, or the flu can also cause a lymphocyte count to be low. A high monocyte count is caused due to chronic infections such as tuberculosis or a fungal infection. The presence of a condition such as endocarditis, inflammatory bowel disease, monocytic leukemia, juvenile myelomonocytic leukemia, scleroderma, or rheumatoid arthritis can also cause a count to be high. Most physicians do not consider a single low monocyte count as significant. However, low monocyte results on several tests can indicate hairy cell leukemia or bone marrow damage. A high level of neutrophil count can be an indication of an acute bacterial infection, inflammation, tissue death, stress on the body, or chronic leukemia. The neutrophil count may also become high when the person is in the last trimester of pregnancy. A neutrophil count may be low after an adverse drug reaction or chemotherapy treatments. Illnesses such as myelodysplastic syndrome, autoimmune disorders, bone marrow cancers, and aplastic anemia can also cause low neutrophil counts. A differential blood test is one of the different lab tests that is used to confirm a diagnosis of an infection or illness.
Extract 2. Questions 37 to 42. You hear GP Mabel Short discussing arthritis. You now have 90 seconds to read questions 37 to 42.
Hello, my name is Mabel Short, and as a medical practitioner, I think that it would be remiss if I didn't consider alternative medicines. One such alt remedy is acupuncture, a prominent traditional Chinese method of treatment that has taken hold of many parts of the world today. It involves insertion of thin needles through someone's skin in different parts of the body at different depths, depending on the areas affected. It is a form of complementary alternative medical management of patients. Complementary alternative medicine is defined as non-conventional treatment approaches of diseases in which the methods used vary from those that we use in hospital. Examples range from use of herbal medication, yoga, tai chi, dietary restrictions like Atkins diet, to acupuncture and cupping, among other examples. The CAM methods vary from the conventional treatment techniques since they are mostly based on the beliefs of both the healer and the patient that the treatment technique used will treat the whole body. On the other hand, the conventional medicine is an approved way of treatment in that the healers undergo certain treatment of the entire body systems. Therefore, the medical professionals in conventional medicine direct their techniques and medications to specific body system or parts that are ailing, unlike the CAM that treat the whole body, mind, spirit, and soul. Another difference is that the conventional medicine is more invasive as compared to CAM, which needs less body invasion for treatment. Another difference is that not all people who seek CAM are sick. Others does so to maintain their health or when they have sought the conventional treatment but have not recovered fully. For successful acupuncture, the acupuncturist must have knowledge and skills required during the process. When someone gets sick, the acupuncturist insert the acupuncture needles appropriately in a combination that they understand in order to bring back the body's power and energy back or for restoration of body balance. Some of the acupuncturists use neuroscience to identify the acupuncture points to be areas where the nerves, muscles, and connective tissues find their stimulations. They then turn their acupuncture needles with aim of stimulation of the areas where the belief that increased stimulation increases blood circulation and, on the other hand, triggers the body's natural painkillers to relieve pain. They believe that for the body to work perfectly well and healthy, there must be harmonious maintenance of balance of life forces called qi that travel through meridians or pathways in an individual's body that can be assessed through 350 acupuncture points. When the force of life is interrupted, someone becomes ill. The needles being inserted in a person's body are of different sizes and insertion is done depending on the site acupuncture, knowledge of acupuncturists, as well as type of disease the patient has. The needles take 3 to 15 minutes or more at the point of insertion, depending on the severity of the problem. Treatment duration also vary depending on the patient's preference and severity of the problem. Just like any other medical practice, acupuncture should be regulated. According to British Acupuncture Council, any form acupuncture should only be done by specialized acupuncturists and be governed by a recognized statutory body. For example, there are several supervisory and governing acupuncture boards. Acupuncture is legal in the United Kingdom, and the British Acupuncture Board has more than 3,000 specialized acupuncturist members. The board ensures that they are trained according to the World Health Organization guidelines. Acupuncture is used in several ways as follows: pain management, headaches, and migraines, counteracting nauseating effects of chemotherapy, sprains, blood pressure variations, dysmenorrhea, rheumatoid arthritis, and peptic ulcers disease. Acupuncture can also be used in induction of labor, treatment of dental pain, as well as reduction of risk of developing stroke. Acupuncture practice has some of the disadvantages or complication that may arise during the treatment or after. They include systemic infections, increased of bleeding in patients with unknown or known hemolytic disease and are on blood thinners, bruising and soreness on the insertion site, broken needle trauma, and atelectasis, among others. Atelectasis can occur when the needles are inserted deeply into the chest cavity or on the upper back region. As a result, they can cause injury to the lungs leading to collapse. The acupuncturist should be keen when doing the procedure to avoid any pricking on clients with bleeding disease or those on blood thinner drugs. Infections may set in through the insertion sites into the individual's system. Therefore, expertise skill of using sterilized needle and equipment is paramount during acupuncture.
That is the end of Part C. You now have 2 minutes to check your work.